If you've ever tried to sit down with a stack of Medicare brochures to figure out what parts A, B, C, and D actually mean, you know how confusing and frustrating it can be. One page says one thing, the next says something else, and before long you feel like you need a law degree just to understand your own healthcare. Today, I'm going to reveal the single most important insight that makes everything click. Once you understand the difference between Medicare Advantage and Medigap, the rest of Medicare becomes a whole lot simpler. By the end of this video, you won't just know the basics. You'll be able to confidently choose the path that makes sense for your life, your health, and your wallet. So let's dive in. Hey there, I'm Steve, your local insurance agent here in Christiansburg, Virginia. I've been helping individuals all across the New River Valley, Pulaski, Floyd, Giles, Montgomery County, and beyond navigate Medicare for years, and today I'm breaking down the difference between Medicare Advantage and Medigap or Medicare Supplement in a way that makes sense for everyday people like you and me. Medicare has four parts. Part A, hospitalization. Part B is medical insurance, things like doctor visits, tests, and outpatient care. Together, A and B make up what's called Original Medicare. Part C is a Medicare Advantage, an alternative way of getting your benefits. Part D is prescription drug coverage. Original Medicare is great coverage, but it doesn't pay for everything. You're responsible for deductibles, copays, and coinsurances. That's where people usually make their big decision. Add a Medigap plan to cover those gaps or switch into a Medicare Advantage plan. Think of Medicare Advantage as an all-in-one bundle. For a lot of people, these plans feel a lot like the health insurance they had through their job before retirement. One insurance card covers hospital, medical, and usually prescriptions as well. Many Advantage plans toss in extras like dental, vision, or hearing benefits. By law, Medicare Advantage plans have to cover everything Original Medicare covers. Premiums are usually lower, but the trade-off is that you'll have copays when you use services, and you'll need to stay in the plan's networks of doctors and hospitals. If you travel outside the service area, only emergency care or urgent care is covered. One thing in Medicare Advantage does well is protect you from runaway bills. Every plan has an annual out-of-pocket maximum, usually somewhere between $5,000 and $9,000. In 2025, the official maximum for in-network services is $9,350. Once you hit that number in a year, the plan pays the rest. Most Advantage plans come in one of two main flavors, and they'll probably be familiar to you. You've got your HMO plans or health maintenance organizations, which generally have the lowest costs but require you to stay within their specific network of doctors and usually get a referral to see a specialist. There are PPO plans or preferred provider organizations that offer more flexibility to go outside the network, though it'll cost you a bit more. Now let's talk about Medigap, or also called Medicare Supplement. These plans work alongside Original Medicare, filling in the deductible, copays, and coinsurances. Medicare pays first, your Medigap pays second, and you're left with little or nothing to worry about. Medigap or Medicare Supplement plans allow you to see any provider that takes Medicare, which prevents an individual from having to worry about whether a healthcare provider they need is in the network with their insurance. The biggest benefit? Predictability. You pay your monthly premium, and in exchange, you know your costs won't balloon if your health changes. With Medigap, you can also see any doctor in the country who accepts Medicare. No networks, no referrals. Now here's an important rule. You can't have both Medigap and Medicare Advantage at the same time. It's one or the other. And timing matters. You get a one-time Medigap open enrollment period when you first sign up for Part B. During that period, you can enroll without medical underwriting, meaning no health questions, no denials, no extra charges for pre-existing conditions. If you wait and try to sign up later, insurance companies can look at your health and in some cases deny you or charge higher premiums. That's why it's crucial to get it right the first time. So how do you decide? Medicare Advantage is best if you want lower monthly premiums, don't mind using a network, and you're mostly staying local. It's convenient, all-in-one coverage, but your costs can add up if you need frequent care. Medigap is best if you want stable, predictable costs, the freedom to see any doctor nationwide, and peace of mind if you live with a chronic condition that requires regular care. The premiums are higher, but they can save you lots in the long run. If you're here in the New River Valley, whether you're in Christiansburg, Pulaski, Floyd, Giles, or any of our other surrounding counties, I'd be honored to sit down with you and walk through your options. My guidance is completely free and there's never any pressure, just honest, neighborly help to make sure you're on the plan that truly fits your life. You might be wondering, where does prescription drug coverage or Part D fit into all this? That's exactly what I'll cover in my next video, so hit the subscribe button and ring the bell so you don't miss it. Thanks for watching, and I'll see you in the next one.